more productive society. Ayo Damope, Ogurinde report.
All right, you're welcome back from that report. We have our analyst, yes, on call now. Hello, good morning.
Good morning, Dr. Kilani Hassan Taiwo. Are you there?
Good morning. Good morning to our listeners too.
Thank you very much. Doctor is a consultant psychiatrist, Futa Teaching Hospital,
Wow.
Akure.
All right, doctor. Hello, doctor. Doctor, are you still there?
Yes, I'm sure you can hear us.
All right.
Doctor, can you hear us?
Yeah, please.
Okay.
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 All right, doctor.
I can hear you now.
Yeah, good. Good.
Doctor, today this is Glow Focus, and we have I have Mike and Comfort. We'll be asking you a lot of questions concerning concerning World Drug Day. Today, the theme of the World Drug Day problem: persisting issues, new challenges, and innovative responses. And my question now is that, despite billions of dollars spent globally on anti-drug campaigns, tighter border security, and international cooperation over the past 4 decades, illicit drug production and consumption continue to rise. Does this suggest that the global war on drug has fundamentally failed, or are governments simply fighting the wrong battle?
Oh, thank you for this question. So it's not a yes or no answer. It's actually a journey. So government is tackling this problem, this menace, in a way that might be exactly the solution. Now, let's start by saying drug problems are viewed as moral failing by people. People believe when individuals use drugs, that is a problem that has to do a lot with the morals, the person is irresponsible. However, it goes deeper than that, because drug use problem is evolving every day. Drug use problem is a biological concern, is a medical problem. It could have started as a moral problem, but then due to the wiring of the brain that occurs as a result of the use of these substances, it then becomes a medical problem. So you have to treat it as such. Now, there is a different angle to it, which is the fact that we now have people who see this as a means of making money, the dealers. We have dealers, we have scientists who produce new drugs. So there's a concept called new psychoactive substances. These are drugs that even the practitioners have to keep up with. These drugs come up every day. As a matter of fact, at the last drug report, there were about 118 of them that come out. What this means is, when these people come to the hospital, the previous one you used to treat them is not what you would do. You have to then be sure of what you are dealing with. Secondly, the law enforcement agency find it harder to track these people down as before, because they don't use the regular route. They don't pack these medications, these drugs in the regular way. They don't sell them in the regular place you expect them to sell them. They sell them on the internet. They sell them on the dark web. They sell them on WhatsApp group. They sell them masquerading them as freshener, air freshener, as fertilizers. So we have to up our game. So government is trying their bit, but because the forces against government is also not resting. So we have to go back to prevention, which is where we actually have to nip it in the bud. We're always playing catch up as we are going along with treatment. So it's not that the government is not trying, but then we have to go back to the basis, which is to prevent it from starting actually.
All right. Thank you very much, Dr. Kilani. Would like to ask you, because as it is at the moment, drug abuse in Nigeria presents a severe public health crisis. And of course, data has shown us that approximately 14.3 million Nigerians aged 15 to 64 are engaged in illicit substance use. And of course, about 70% of these users are under 35 years old. Now, I want to ask you, Doctor, today is World Drug Day. What drug is still destroying more young people in Akure, in Ondo State, and of course, Nigeria as a whole? And is it just the normal thing that we know, or, and what's the first thing the first lie, aside from all of these drugs? Because you have them, whether you have treated them or not, the first lie every addict tells you, and what's the medical truth you tell them back?
Okay, so most addicts will tell you they are taking this drug because they believe it's a natural component. And that's one funny thing. So they will tell you, I'm taking weed because it's natural. People forget that the fact that something is natural does not mean it's good for you. And let's get this right. Most of these drugs have some benefits. And that is where you have to be careful when you are counseling people. When we go with the blanket, all of these drugs are bad. And then the patient now takes it and realizes that it gives them some kind of benefit. Then they don't believe you. But you let them know that, yes, there could be some transient benefit, but then in the long term, it's not good for you. Because drug abuse comes from the word ab and use, abnormal use. So a lot of these drugs, like let's look at tramadol, for instance, is a drug which is prescribed for analgesic property. However, when it is now used abnormally without prescription, then it becomes a bad drug, right?
Yes.
So, what is the commonest substances that's abused? If you look at the World Drug Report for this year, cannabis still ranks as the most commonly used substance in the world. As a matter of fact, the total number of people in the world that use drugs are about 336 million, whereas cannabis ranks as 256 million. Now let's come down to Nigeria. So Nigeria, the last drug report that was done, the national survey was in 2018, which means for the past 8 years we've not done any. And as at that time, we got our own prevalence to be 14.4%. So if you assemble 10 people, about 6 of them have used drugs. Now let's now come down to Ondo State, like Southwest. The region of the Southwest was the highest rank. It was about 22% in Nigeria. And cannabis still ranks as the highest. And we all know about how we are one of the highest producers of cannabis. So the lie people often tell you is that it's a natural product. However, we also know that there are new substances, like the one I said about the new psychoactive substances. There are about 700 of them now. And these are substances that are made from the older drugs, but they are made in the lab. And these substances they keep changing. The chemical components are things that we don't even know of. So a lot of them are now being marketed as, or you see them like the cannabis is marketed as spices, K2. So you have a lot of them coming. They are coming from the old gang. However, they are now coming in new forms. So the commonest lie that they often tell you is that, I'm taking weed is a natural substance. But however, we know that the fact that natural substances does not mean that they can have side effects, bad effects, when they are abnormally used. Which is why we place advice on prevention first. However, if the individual has not started and is not addicted or dependent, then we'll now talk about treatment.
Okay, doctor, I'd like to ask you. We have maps and we have a few things to look at to be a bit more practical. In the state ranking and specifics, Lagos and Oyo lead in overall cannabis consumption and high risk poly drug use cases. Kwara State follows. They've had previous situations cited by NDLEA as having one of the highest state level prevalence rate for drug abuse and trafficking alongside Nasarawa and Niger State. Kano State has one of the highest opioid and cough syrup misuse burden in the north. Is Nigeria as a country prepared for the crisis that may break out of the drug issue for the future? Are we prepared? And if we are...
Hello, can you hear me? I think I lost you along the...
All right, I was asking that. Having read the the figures. Of affected states in Nigeria. Lagos and Oyo leading the pack, followed by Kwara and of course Nasarawa and Niger State. Kano State also, leading with cough syrups, misuse, and all of that. I'm asking you the question now: is Nigeria as a country, are we prepared for the kind of problems that could, bust out of drug use in Nigeria? Doctor, are you there?
Dr. Kilani, are you there?
I asked you along the line, but I thought you were asking if we are prepared for the
Yes,
burden of
yes. Is Nigeria prepared as a nation? And if we are not, what are we to do?
So, like, almost everything that developing nations are up to battle with, we are not yet prepared enough. That's the truth. Because it's not just about drugs alone, it's about a lot of other things. But then we make do with what we have and keep striving. So, the burden of drug abuse is much. And like I said, we have to keep evolving with our treatment. So let me give an example. The first stage of tackling substance abuse is from the family, right? From schools, from the community. We have drug education in our schools as part of the curriculum. How many drug clubs do we have in the schools? Do we have PTA meetings calling experts to come and talk about drug abuse? Do we have parents getting short tips on the WhatsApp pages for parents about how to tackle drug abuse? Do we have any drop-in centers in those states as of now? I just brought it back to the state a few months ago, so maybe I'm not aware. I know we have the NDLEA, but the NDLEA is more for forensic issues to detain people. Maybe they do some bit of keeping them away from the drugs. But we are talking about a drop-in center where people can come into and then they will not be judged. Where they come into and then they'll be able to speak with somebody, get counseling, and then they can be advised on what to do. They can be referred to a treatment center. We do not have that yet. So we are not yet prepared. We are just in the process. And we have to realize also that drug treatment the world over is not done only by government. No. It is something that has to be done by NGOs, by individuals in society, and we have to look at our own peculiarities, which is where I come to our traditional ethos. So as Africans, growing up, you hear about is the community that actually cares for your kids for you. Which is, if you're smoking on the street and then you see somebody, an elderly person coming by, even though this person is not your own father or your mom, you either stop off the cigarettes you're smoking, or you just you run away because you are scared of this person reporting you to your parents. We are losing a lot of those things. We are losing parents who are not looking out for their kids not coming back in time from school. We are looking out on parents who look at the needs of their kids and notice something is changing, because the parents are actually also busy with doing some other things. So it has to be an holistic approach, starting from the family. So we have to start sending that message that it's not just about a child going to the mosque or the church alone. We have to start introducing those information about substance use into them. In the school, you have to start teaching kids on how to be able to cope with social exposure. So a lot of kids, they self-medicate because they can't cope. So you see a student telling you, oh, I can't face people in class. And so because of this, they start using substance. So we have to focus on that. We have to then go to the government. The government have to start making policies that has to help with prevention of substance use. I'm aware of a recent policy by the government that they floated. I don't know if they start implementing now, because we've not started saying that. We should be having drug testing. Now, drug testing for students who are in secondary school will be a way to actually stop it before it starts, or to pick it at an early stage. So you can see that we have a lot of things that we have to rise up to. So once we do that, then we can start now winning the war. But one of the first ways to win the war is to have more people who do not start the use of drugs. Because once they've started, it's now another level of care that we need for such kind of group of patients.
Thank you very much.
All right, talking about government policies that you just mentioned, uh, should drug education become a compulsory subject from primary school through university? Is that what you're saying? Hello, doctor.
Yeah, I think you should actually start. Yes, yeah, I can hear you, please. I think you should actually start from the primary school.
Okay.
I think we should start teaching about it from primary school. We should start having clubs, doing free clubs, because you'll be surprised a lot of times. So it's just like when you hear parents saying that, oh, I don't want my kid to be exposed to sex education. Now, when you don't teach your kids about these things, what they do is they get to hear about it from somebody else. Somebody will tell them, oh, if you take cannabis, oh, you'll feel high. So if a little child is confused, is sad, and then a colleague of his in school, a peer will just say, oh, you can just take from my door. It makes you feel happy. Now, if the parent had already informed them about substance to say, oh, if you take from my door, yes, you might feel a little bit high. However, it could lead to seizure disorder. You could start convulsing. You could start having poor attention, poor memory. You already told the child that, yes, this could give you transient elation of mood. However, in the long run, it's going to cause you a lot of grief in your life. You can see that doing that already, giving that child that education at the early stage. So when they even get to secondary school, there's no one that will be able to change their mind because they're already armed with a lot of education. The same thing when they get to university. I mean, back then in university, we used to attend this JMS program at the university where even if you're a medical student, you still have to take that course. So why not start introducing substance use education to all of these courses so that from primary school to secondary school to university, we have champions of drug-free life. So that people will stop thinking, oh, if I'm talented musician, if I'm not taking substances, my talent wouldn't come out. I wouldn't be able to sing well. I wouldn't be able to paint well. I wouldn't be able to write well. We have to start educating people about that from a very early stage of life.
All right, thank you very much, Dr. Kilani. I think this is a good one because some schools, I'm a parent too, even from primary one, you start see when you ask them what is drug, they'll tell you it's a wrong use of substance and all that. It's already in some schools. I don't know if it's in all schools, even from primary one. I think they've started. That's a good one to endorse the government and to some private schools doing the needful. I hope that other government school follow suit. I hope they have that in their timetable. But I just want you to know that some schools are already practicing that. Even from primary one, they're already teaching them what drug is, drug abuse, and all of that. So away from that, we always talk about boys, the female drug user. Let's talk about that. We always talk about boys using drugs and all that. But in Akure, are more girls showing up in your ward in 2026? I mean, what drugs are they talking, and why is it different from boys?
Okay, so, in my center, we're just about starting inpatient treatment. So, we are yet to have that inpatient treatment starting, but we do outpatient for now. However, with my experiences in other facilities where I've worked before, I know there's a pattern to the use of drugs among females. So you'll be surprised that 1 in 4 drug users are actually females. 1 in 4, which is huge. And the other thing about female drug users is the fact that there is a concept called telescopic phenomenon in which drug users who are females, they get to have more side effects than the males. In fact, they get addicted faster than the males. Now, most of the drugs you will see them use because of our traditional values will be more of opioids. Opioids like tramadol, like codeine, are the ones you see them use. Because a lot of these females are actually self-medicating, low mood, depressed mood, anxiety symptoms. So, and these drugs are quite easy to get from the drug retail shops. In fact, you'll be surprised that a lot of drug retail shops actually make more money from illicit substance sales rather than the real drugs that they sell. And so you see some of them having selling this out to people. They sell codeine syrup, they sell tramadol, and you'll be surprised that you see female students now going to the school with Zobo drink, in which they've dissolved tramadol, they dissolved codeine, and sometimes they even put alcohol in there. And because it's Zobo, I mean, the color is already a camouflage. And so, I mean, you're not even aware that's what they are taking. However, we also have noticed that you can see women these days who also take cannabis. You know, vaping is an emerging thing now in this part of the world. I mean, when I used to practice in the United Kingdom, it was a common thing. You see people vaping a lot. However, we now know that vaping, you can actually vape cannabis. So it's not just nicotine that people vape now. People actually vape cannabis. So you will be surprised that people that will tell you that, oh, it's just shisha. It's actually the cannabis that they are taking. But the commonest one are more of the depressant, which is like the opioids, like tramadol, the codeine, because these people want to sleep, people want to be less anxious, these people want to be away from the world. They are depressed and they want to. So for females, it's more of what you might find in females, whereas the males are the guys who would openly go for the weed. If they are rich enough, they will go for the cocaine, and then the drugs die down. And so you see like the stimulant, the cocaine, all of the big drugs there.
Okay, doctor, let's look at this angle as well. You've talked so much about those you meet every day who are drug addicts and those you have had to attend to, plus what we can expect as a nation. Omoyele Sowore, a politician in Nigeria, has not really advocated for the general cultivation or abuse of illicit drug. Rather, he has consistently campaigned for the legalization, regulation, and export of cannabis, that is marijuana, for economic and industrial plus medical purposes. He was of the opinion that there are millions, multi-billion dollar global market by treating cannabis strictly as a law enforcement issue instead of an agricultural asset. I mean, is this something that the Nigerian government can still consider looking at the height of drug abuse in the streets of our country?
You put me in a tough spot. This is actually a tough question, but then it actually brought to mind for me while I was the president of resident doctors during my training years.
Okay.
This was the topic we actually brought, legalization of cannabis. And this same question was a question that we couldn't answer by picking just a spot.
Wow.
And I'll tell you why. So, the reason is because we've been advocating for legalization for planning of growing of cannabis, right?
Yes.
Along all these years. We don't seem to be winning. Now, if we have to regulate, because most of these people that actually sell this substance, this weed in particular, they are selling it for profit. It's not because they want people to get high for the good of their heart. No. It's because they want money. So the argument by the people who would say, let's regulate it, let's make it for economic purpose, is that if these people are aware that they can make money without getting people high, then they will grow this cannabis and hand it over to governments, right? And then it wouldn't be out in the market. However, there is another argument which says if you start doing this, then cannabis will flood the black market. So it will become more expensive, but it will still be available. And once it is on the black market and it's not expensive, now these same people that we know what is driving them is just pure economic gratification, right?
Yes.
They would now see a reason to sell for recreational use. Now, the other thing is to look at the countries who have legalized cannabis. Some countries have done that. However, when you look at the studies that have been done in this country, they notice that there have not been significant increase in the use. However, they got to find more people who are having drug use disorders in those countries. Now, they were careful about being very specific about how bad it has become. So most of these countries, they've done this in the last 10 years, thereabout. So that we actually don't have concrete evidence to say, okay, this regulation did not work well. But we know that in Nigeria, we are not so good at regulation. That's the plain truth. when we start doing that, we say we want to regulate. You will start seeing corrupt officials. You will start seeing somebody who has to be the one to sign it off, wanting to enrich themselves. So, and that is the argument for people that would say we are still too young, too naive, and not so orderly in that sense for us to try to regulate. So you can see, we have not given you an answer, that just giving you
I know.
this downside to both, which is where I will leave it at. But then, as a practitioner, I would say anything to take away substance from individuals, not to start it at all, is what I would advocate for as a psychiatrist.
All right.
Now, if I was an oncologist, because cannabis could be used for end-stage pain relief, yes, I could then be advocating for that. So if we could find a way to make the regulation good without making it falling into all of those traps that I've mentioned before, then we could do it. But how good are our institutions? So that's why we leave it for now.
All right, thank you very much, Doctor. Let me quickly ask you this from my end. From your experience, your wealth of experience as a psychiatrist, even at FUTA, what treatment model has the highest recovery rate so far? Is it detox? Is it counseling? Is it rehab? Is it community support or faith? Or what's a waste of money exactly? I want you to be very specific. I want you, because Nigerians are listening at this time.
Okay, so this will depend on the choice of treatment will actually depend on the severity of the use. So an individual could be, so we have about 4 stages. So the first stage is an experimenter. So somebody, a young boy in school, while we're growing up, you roll up a paper and then you want to model like the adults. So experimenting is one stage. The second stage will be a social user, right? Someone who, when he goes out with his friends, when he drinks alcohol. Then the third stage will be someone who is a healthy user, right? So that is like the next stage before we get to dependent user, who is an addict, who, if he doesn't use alcohol or any substance, will start having withdrawal symptoms, would do anything to use substance. This individual would persist in the use of substance despite having problems with their work, with their family, with their business. They will still persist. So people that have this kind of features are those that we call dependent user. So if an individual is coming as an experimental user or a social user, and we've noticed that we don't want this person to continue, for such an individual, we can do just community treatment, which will be outpatient treatment, right? And basically, the outpatient treatment will comprise of psychosocial treatment. So we have different settings. So the setting could be inpatient, outpatient, but we also have 3 components, which will be biological treatment, which is the use of medications, psychological treatment, the use of psychological intervention, and then social treatment. So the biological treatment is what we use when we have a severe case. So we use it alongside psychosocial treatment, and we do that on inpatient basis. However, for individuals who are just social users, experimental, we can ask them to be coming to the see the psychologist maybe on a weekly basis, and then they'll have that kind of treatment. So they can be community-based treatment for such individuals. Now, for those that are heavy users, and mostly those that are dependent users, you have to admit them because most of the time they have other comorbid conditions, like they could have depression, they could have anxiety disorder, they could even have psychosis. We've seen that a lot, and they could also have physical conditions like liver problems. They could have lung problems. They could have even cancers. They could even have multiviral conditions. They could have HIV. They could have hepatitis. Because some other drug users, they use injections, and we have about 9.something% of drug users who inject having HIV in Nigeria. So, and the reason is not far-fetched because they share needles, which is one of the reasons why the new things that are done in countries is to do harm reduction. So, like for those individuals, you can say, oh, they should not share needles. They will come to the hospital to get needles. So, the kind of treatment we will give dependent users would be inpatient. And that's why when people come to me and ask me, oh, we have this person using drugs, what can you do for them? I'll tell them, he has to be admitted, except I'm just joking with you. They have to be admitted because first is for the first 1 month, we are treating the other conditions. We are treating the physical health condition, the withdrawal symptoms. We are treating the psychiatric condition. After that is when you can now start with the main treatment, which is psychological intervention and social treatment. Now, for social treatment, a lot of people do not know how important this is. They don't even know how important a social worker is to the mental health team. So imagine you have a patient who has a problem with his wife, and that was why he started drinking alcohol or with his husband. And you've treated them for substance use, but they are returning back to this same marriage. I mean, it's just like you've not done anything. We have somebody that was unemployed, and this is why the guy started eating the bottle or he started smoking weed. And then you've managed this person so well, and then you are releasing them back into the community, but they don't have a job. So one of the treatments is why they are on admission to start for the occupational therapists to assess them, for the social worker to now look at, how can this person be gainfully employed? So you can see that the treatment has a lot of levels to it. So it's depending on the that will be what will determine if it's going to be community based. Eventually, you have to go back to the community because after we discharge the patient, then they will be coming for follow-up, regular follow-up, where we'll be doing drug screening to be sure if they abuse substances, and then we'll be doing counseling, we'll be checking on them, seeing if any stress or any trigger is around the corner. So eventually go back to the community. But initially, for severe cases, is inpatient. For mild cases, we can do outpatient community treatment.
All right. Let me quickly ask this questions concerning our society. We have to, prevent our society. If you had the power to introduce one policy capable of reducing, drug abuse by 50% within 3 years, what would that policy be and why?
Fun. Because there are a lot of places I would have loved too. I think the first one for me, because I'm a community psychiatrist, would be.
Hello. Doctor, are you there? Okay.
Go ahead.
So to prevention, and when I say prevention, it will now go into different angles because prevention will come with government policy on drug clubs, government policy on like the one about testing students. Some universities have started doing that, even though there are ethical issues around it, like, are you saying somebody cannot have the right, an adult? Are you trying to test them? I know the NDLEA once suggested having our politicians to have drug tests, which I actually think will not be a bad thing because if we have our politicians having drug tests, then we have people who will be champions of drug-free world. So the prevention will be the policy that we want to. We can now break it down. But prevention is still the best treatment for drug use. Prevention. The other one would be to have drop-in centers because there are some people that are already into it that want to go out, but because of the stigma attached to drug use, with just like most mental health conditions. So this stigma is now a great barrier to treatment. So I will do prevention, then a drop-in center for people who want to look for a way out. People who can't go to the psychiatric hospitals. People who don't even have enough money to even consult a doctor or a specialist. So it will be prevention, then a drop-in center for people who want to get out.
Thank you very much, Dr. Kilani. Comfort, you have...
No, that's all. Our
Thank
time
you
is
very
fast.
much,
Thank you
Doctor.
very much, Doctor.
All
Thank
right.
you very much for your time, Dr. Kilani.
All right, we'll be moving on to this.
You're welcome.
Yeah, do
Thank
well
you,
to enjoy
Doctor.
the rest of your day. Thank you for your time.
Bye-bye.
Bye, Doctor.
All right, just in case you'd like to drop your opinion, you can always text us on Facebook in the comment section. Search for GLOW 99.1 FM Akure or call the studio lines 0805 551 1110 or you call the second line 0706 677 1822. I guess we'll move to sports now. In the meantime, we've got stories from other sports and also the football side, especially with the World Cup going on now.